we have campus chapters in schools of nursing, and our goal is to help nursing students become advocates and activists, but also to gain education through curriculum and educational experiences, and to affect curriculum change in their schools of nursing to get more sexual and reproductive health content, because it turns out there's just not much. One thing is that organizationally we've moved away from being focused on abortion, and we are kind of understanding that most nurses aren't going to work in abortion care, but what we really want is an educated healthcare workforce that can take care of people in any setting. So we know that most nurses, when they get out of nursing school, they're going to go into med-surg, they're going to be in the ER, they're going to work in a pediatrics office or a variety of healthcare settings. Very few of them will ever actually do abortion or work in abortion facilities. We still want for them to be armed with this information and to be knowledgeable and to have already done some values clarification work so that they understand their own implicit bias and can treat people compassionately and humanely while delivering safe healthcare. So that's kind of how we got into something more general than abortion. And I'm really supportive of the move. I think it's a really, really good move for a variety of reasons. One, just that, the general population deserves to have good health care.
Sure.
And also that in schools of nursing, talking about abortion is still really, really difficult. And, you can't go from 0 to 60 always. So it's a little bit more of a stepwise or subversive way of getting that content in, being able to talk about other sexual and reproductive health topics. So we want them to also know about intimate partner violence and trans healthcare and these other kind of more intersectional problems. And, working through the reproductive justice framework kind of demands that of you, that you use that intersectionality. So that's how we got there. Sexual and reproductive health exists at the crossroads of health and ethics and culture and policy. It's kind of at this merging point of all of these pieces, these places that come together, and it is distinct and separate from other topical things. And so not like nurses need to have done values clarification, like just that basic piece of what bias are you bringing in, what lack of information are you coming in with, just even the assumption that people who are going into nursing school ever had any sexual education of their own is a huge assumption to make. So it's kind of starting at ground zero a little bit, but really hoping that the workforce can eventually have done that work just to create a more humane world. I actually am a midwife, and I have almost 20 years of clinical abortion experience. So I grew up in independent abortion clinics. That's where I worked forever and a day, and I kind of have done everything in that context that you can do. So I really came into this work with a pretty heavy focus of my own on abortion and really wanting it to be about abortion and kind of keep it there and feeling like actually it was kind of interesting because I almost felt a little bit threatened myself by like it was being watered down somehow, or like somehow it was going to get lost, and maybe it becomes really easy to just not talk about it, because if you start talking about these other things and they're easier, then maybe you just lose it altogether. And I was really concerned about that. I feel less concerned about it now, because just organizationally we do still always make sure that abortion is brought into the conversation. It's just part of what we do, so we haven't dropped it out as a topic. And also just because I feel like working with, now having gone out of the abortion world, which I was pretty heavily embedded in, into just schools of nursing where I'm just dealing with nursing students and I'm just dealing with nursing faculty, I just see it's the whole thing is a blind spot. The whole package is missing, So it's like you almost just can't talk about one thing. Or alternatively, the other really strong benefit of doing that is that some places, the only way that they can talk to their faculty about it is through the lens of HIV. It's something that people are really focused on here. It's still a major public health crisis in this area. And so it's kind of the only topic that they can talk about with their faculty and their professors. And we're just hoping that gradually over time they can start, saying, oh, well, here's this other thing that we're really interested in. People really want to know about trans healthcare. People really want to know about abortion. People really want to know about intimate partner violence. So I am just hoping that it becomes an avenue, like a way in with people who, and these are the friendly faculty. These are the people who are really focused on sexual and reproductive health, but they also have their own tunnel vision around what it is that they can talk about and do. I support independent abortion care providers because they really are the bedrock of abortion provision. They provide the most friendly models of care that I've seen, and I think it's kind of that discussion about, whether abortion can ever just be treated like other medical procedures is like a thing. we talk about that, like how can we get the whole world to just treat abortion like a medical procedure? But the fact is that it's not just a medical procedure. It's not ever going to be, just in the same way that childbirth is not just a medical procedure, and that as it became more medicalized, the population pushed back. Like, women don't want that. And I don't think that women want abortion to just become another medical procedure either. We need to continue to provide holistic, compassionate care, and I think that independent abortion providers, the ones that I've been privileged to interact with, really have found ways to do that, even within the context of these egregious policies and laws that they have to work within. So I think it's also a really great training ground for people. I trained in independent abortion clinics, and I got to have experiences that I never would have gotten in a hospital setting or in a corporate setting. So I just feel like the access to humanity and to your own humanity when you work in an abortion clinic, in an independent clinic, is really just kind of a special piece of it.
Yeah.
Yeah.